Black fungus and COVID-19 myths and facts. In India, COVID-19 has led to a surge in cases of a potentially fatal fungal infection called mucormycosis, popularly known as black fungus. The infection is every bit as dangerous as the media have portrayed it. But several myths are circulating on social media about potential sources of the infection and its treatment. The human body is not the usual habitat for fungi that belong to the order Mucorales, which includes species typically found in soil, dust, decomposing vegetation, and animal dung. Our immune system is usually more than a match for the fungi, but an unholy trinity of diabetes, COVID-19, and steroid treatment can weaken a person's immunity to such an extent that these microorganisms can gain a foothold. Diabetes not only increases a person's risk of severe COVID-19 but also provides conditions in which fungal infections can thrive. To make matters worse, both COVID-19 and the steroid dexamethasone, which intensive care doctors use to treat it, suppress immunity. The ensuing infection known as mucormycosis spreads rapidly from the nose and sinuses to the face, jaw, eyes, and brain. On May 26, 2001, there were 11,717 confirmed cases of mucormycosis in India, which has more people living with diabetes than any other country in the world except China. Even before the pandemic, the prevalence of mucormycosis may have been 70 times higher in India than the overall figure for the rest of the world. The fungus blocks blood flow, which kills infected tissue, and it is this dead or necrotic tissue that causes the characteristic black discoloration of people's skin rather than the fungus itself. Nonetheless, the term black fungus seems to have stuck. Professor Malcolm Richardson, a professor of medical mycology at the University of Manchester in the United Kingdom, told that the name is totally inappropriate. From a mycological point of view, the term black fungus or black yeast is restricted to fungi called Demetiaceae, which have melanin in their cell walls. Many people have tried to correct this on Twitter, but to no avail. He said the media in India are now using the similarly misleading terms white fungus and yellow fungus to describe supposed variants of mucormycosis. Fatality rates. Without immediate treatment with an antifungal medication and a surgery to remove necrotic tissue, mucormycosis is often fatal. Before the pandemic, the Centers for Disease Control and Prevention reported an overall mortality rate of 54%. A 2021 systemic review of all COVID-19 related cases published in the scientific literature found 101 cases, 82 of them in India and 19 from the rest of the world. Among these cases, 31% are fatal. Dr. Vadish Kumar Singh and his co-authors report that around 60% of all the cases occurred during an active SARS-CoV-2 infection, and that 40% occurred after recovery. In total, 80% of the patients had diabetes, and 76% had been treated with corticosteroids. Myths about transmission. Several theories about the source of mucormycosis infections are circulating on social media. Many of them unfounded. Person-to-person transmission. Crucially, mucormycosis cannot be transmitted from person to person, so there is no need for people to isolate, unless, of course, they have an ongoing ACRS-CoV-2 infection. Rather, the source of infection is environmental, from airborne spores produced by the fungi. Fungi growing in water, oxygen cylinders, humidifiers. Some media pundits have concluded that the fungi must be growing in dirty water in hospital, oxygen cylinders or humidifiers. However, there is no evidence that this can occur, and mycologists have pointed out that fungi cannot produce spores in fluid. What is more, the pure oxygen stored in cylinders is likely to be detrimental to the growth of microorganisms of all kinds. Face mask harbor black fungus. This is a myth. There is no evidence that face mask can harbor the fungi. Onions are to blame. Another popular theory is that the black mold sometimes seen on onions in refrigerators is mucorales fungus and therefore a potential source of infection. As we have seen, the species in question are not black. In fact, the black mold found on onions and garlic is usually the fungus Aspergillus niger. In a 2019 paper, Professor Richardson and his co-author explained that mucorales fungi grow on moldy bread, decaying fruit and vegetables, crop debris, soil, compost, and animal extra. He points out that they have a high moisture requirement and are unlikely to survive on common building materials such as wood, painted surfaces, and ceramic tiles. Possible routes of transmission. Published evidence points to several potential sources of the infection in hospitals, but it does not mention oxygen tanks, humidifiers, or face mask. Two studies published in 2014 and 2016 respectively implicate hospital linens from poorly managed laundries as a source. A 2009 review of research into hospital outbreaks identifies ventilation systems, wooden tongue depressors, adhesive bandages, and ostomy bags as other possible sources of infection. Pathologists at the University of Kentucky in Lexington report that another possible transmission route in the inhalation of spores in dust from nearby building works or contaminated air conditioning filters. They also highlight the importance of infection through the skin, for example via burns, catheter insertion sites, needle stick injuries, insect bites, and stings. Proven treatments. A video doing the rounds on social media proposes that a concoction of mustard oil, potash alum, rock salt, and turmeric can cure mucormycosis. In reality, the only proven treatments are surgery to remove necrotic tissue and the antifungal amphotericin B. However, India now faces severe shortages of the drug. Just as importantly, doctors are advised to address the underlying causes of impaired immunity, especially poorly managed diabetes and overzealous use of corticosteroids.